You know, sometimes you hear about a medical condition and it just sounds, well, almost unreal.
Yeah, definitely.
Today, we're doing a deep dive into one like that.
Yeah.
Dysautonomia, sometimes called Key-Gaskell Syndrome.
Mm-hmm.
We got some pretty detailed medical info here, and our goal is basically to pull out the key stuff. You know, what is it? Who gets it? What are the signs? And what do we actually know about it?
Right. Consider it the express version.
Exactly. Your quick guide to a really complex topic. Okay, so where do we start?
Well, what's really fascinating, I think, is how it highlights just how complex the autonomic nervous system is.
Okay.
It's like the body's background manager,
Yeah.
making tons of decisions every second without us thinking about it. Dysautonomia just throws that whole system into chaos.
Right.
So Key-Gaskell Syndrome, specifically, it's this failure of the autonomic system. It can't regulate multiple organs properly. But, and this is key, the animal's movement and senses are usually mostly okay.
Okay, so the automatic stuff goes haywire, but they can still walk and see, basically.
Pretty much, yeah.
And the profile from the sources is, well, it's quite specific, isn't it? We're talking mostly young adult dogs.
Yes, young adults, often in rural areas, especially the Midwest, that's a pretty clear pattern.
That really stands out. And it also mentions treatment is about managing symptoms, and the outlook is guarded.
Unfortunately, yes. That sets a serious tone right away.
It does. So this autonomic system, it controls things like heart rate, digestion.
Exactly. Heart rate, breathing, digestion, urination, even like tear production, all the stuff that just happens.
Right, without you thinking.
So when that system fails across different organs, the effects can be, well, all over the place.
So we know it's mainly young rural dogs. Are there any other details, like why them? Any ideas?
Well, dogs are definitely the main ones we see. Cats can get it too. It's just less common.
Oh, okay.
But interestingly, the sources say there's no real link to a specific breed or sex. It seems pretty broad in that sense.
Huh. No specific breeds.
Nope. And the median age is around 18 months, though it can technically happen at any age.
18 months. That suggests maybe something they're exposed to early on, or a developmental thing.
That's the thinking, yeah. Some common exposure, or maybe a susceptibility window around that young adult stage.
Okay, let's shift to what you actually see, the signs. It sounds like it comes on pretty quickly.
Yeah. Acute to subacute is the term. Usually develops over, say, 5 to 14 days. So fairly fast.
And the symptoms themselves.
Yeah.
It sounds like a real mix.
It really is. The key thing is finding signs of both sympathetic and parasympathetic problems affecting different organs. That's a big clue for diagnosis.
Both systems acting up.
Exactly. Think of them as the gas and brake sympathetic speeds things up, parasympathetic slows things down. If both are malfunctioning across the board, that's significant.
Okay.
And like we said, crucially, there's minimal impact on actual movement or senses. That helps differentiate it.
Right. So let's list some of these signs. Gastrointestinal stuff seems common.
Very common. Vomiting or maybe regurgitation, which is slightly different. Diarrhea, sometimes constipation even.
And urinary issues, too, like straining.
Yep. Straining to pee, maybe dribbling urine. That points to bladder control issues.
Then there are eye problems. Photophobia, sensitivity to light.
Photophobia, and the third eyelid might be noticeably raised.
Third eyelid.
Okay.
And even breathing problems.
Sometimes, yeah. Difficulty breathing, maybe coughing. Sometimes a purulent nasal discharge, like a thick snot.
And just generally, the animal seems unwell.
Absolutely. Depression, not wanting to eat, anorexia, and weight loss are really common presenting complaints. It's a whole constellation of signs.
Wow, that is a lot. And it all stems back to that autonomic system failure.
Exactly. The GI signs show gut motility is off. Urinary signs mean nerve control of the bladder is lost. Eye signs come from nerve issues around the eye muscles. Respiratory can be secondary, like from inhaling food or maybe direct effects.
And when a vet examines them, what specific things might they find?
Well, loss of anal sphincter tone is a pretty specific one.
Right.
Also, really dry nose and mouth, dry mucous membranes. And related to that, not enough tear production.
So dry eyes, dry mouth.
Yeah. And the bladder, it might be really full, distended, but easy to express manually, like the muscle tone isn't there to hold it in or push it out properly.
And the pupils. You mentioned light sensitivity.
Right. The pupils are often kind of mid-range or even fully dilated, and they don't react to light, but importantly, the animal can still see.
It's weird. No light reflex, but they can see.
Yeah, it tells you the problem isn't the vision pathway itself, it's the autonomic nerves controlling the pupil muscles.
Gotcha. And the dry membranes, the bladder thing, that's all lack of nerve signals again.
Precisely. Failure of autonomic control over secretions and muscle function.
What else on examination? More eye signs?
Yeah. Besides the third eyelid being up, you might see the upper eyelid drooping. That's called ptosis. And inophthalmos, where the eye looks kind of sunken.
Okay. And in the gut?
Often you won't hear many gut sounds. Borborygmi, the rumbling, might be absent. Sometimes they seem to have abdominal pain too.
And cardiovascular? Heart rate?
Typically, heart rate and blood pressure are sort of low normal, but the really telling thing is they don't increase with stress like you'd expect.
Ah, that blunted stress response.
Exactly. That's a classic sign. The body can't ramp up that fight or flight response properly because the sympathetic system isn't working right.
And all this can lead to secondary problems, right? Like pneumonia.
Definitely. Aspiration pneumonia from swallowing issues is a big one, or rhinitis, and just the overall wasting, the cachexia, from not eating or absorbing nutrients well.
And sometimes, maybe some minor weakness.
Occasionally, yeah. Mild proprioceptive issues, knowing where their limbs are, or just some weakness. But again, the main issue isn't the motor system itself.
Okay, so moving on to causes and risk factors. This is where it gets a bit fuzzy, right? The source says the cause is unknown.
Yeah, that's the big challenge. Still unknown.
But there's that geographic thing. Really high incidence in places like Missouri, Oklahoma, Kansas.
Wyoming, northern Colorado, too. It's quite clustered there, although you do see occasional cases pop up elsewhere in the U.S.
And the highest risk group, again, free-roaming dogs in rural areas.
Right. That combination, the geography and the free-roaming rural lifestyle, it really strongly suggests some kind of environmental factor.
Like a toxin. Or an infection specific to those areas.
Could be a toxin, maybe pesticides, maybe a plant. Or an infectious agent, maybe carried by insects common there. Something they encounter being outdoors in those specific regions.
But we don't know for sure yet.
Not definitively, no. That's a major area for research.
So if a vet suspects this, how do they actually diagnose it? It sounds tricky with all those varied signs.
It is. Diagnosis often involves ruling other things out first. That's the differential diagnosis process.
And top of that list is anticholinergic toxicity.
Yes, because the signs can overlap quite a bit. Things like certain plant toxicities or medication exposures.
And then other possibilities depend on the main symptoms.
Exactly. If the dog's straining to urinate, you think UTI first. If the eye is bothering them, maybe a corneal ulcer, dry mouth. Could just be dehydration. You have to rule out the more common stuff.
That makes sense. Start simple. What about basic lab tests? Blood work, urine tests.
Usually they're pretty unremarkable. Standard CBC, chemistry panel, urinalysis often don't show much wrong.
So the blood work is normal.
Often, yeah. Which kind of supports the idea that it's a functional problem with the nervous system, not necessarily like organ failure showing up in the blood.
But imaging can help.
Yeah.
X-rays, ultrasound.
Yes. Imaging can show some key things. Megaesophagus, that enlarged esophagus, is common. Sometimes you see aspiration pneumonia alongside it on chest x-rays.
Okay.
Abdominal x-rays or ultrasound might show really distended loops of bowel that aren't moving, no peristalsis, and again, that distended bladder.
And the heart?
An echocardiogram, an ultrasound of the heart, might show what's called systolic dysfunction. Basically, the heart muscle isn't contracting as strongly as it should.
So the imaging findings really match up with the clinical signs of regurgitation, the gut issues, the bladder problems, even heart function.
They do. They provide objective evidence of that widespread autonomic failure.
Are there more specific diagnostic tests mentioned?
Yes, a few specialized tests can help. There's the pilocarpine eye drop test.
How does that work?
Well, if the pupils are dilated and not reacting, you put a very dilute pilocarpine solution, like 0.05% in one eye. Pilocarpine directly stimulates the pupil to constrict.
Okay.
If the pupil does constrict within about an hour, it suggests the receptors in the eye are working fine and aren't being blocked by an anticholinergic toxin, so it helps rule that out.
Interesting. What else?
There's the atropine response test. Atropine normally blocks the parasympathetic system, which usually makes the heart rate jump up.
Right.
So you give a dose intravenously. If the heart rate doesn't increase much, it suggests the parasympathetic control over the heart, the vagal tone is already lost or greatly reduced, which fits with dysautonomia.
Okay, so lack of response suggests the system's already down.
Pretty much. And then there's an intradermal histamine test.
Histamine, like for allergies.
Sort of. You inject a tiny bit of histamine into the skin. Normally, you get a little bump, a wheal, and a red area around it, the flare. That flare depends on local nerves, specifically sympathetic nerves to the tiny blood vessels.
And in dysautonomia.
If those sympathetic nerves aren't working right, you might get the wheal but no flare, or maybe just a very weak reaction. It indicates loss of sympathetic innervation in the skin.
Wow, okay. So several specific tests can point towards this diagnosis.
They can help build the case, yes, alongside the history and clinical signs.
All right, let's talk treatment. The sources are clear. It's symptomatic, meaning you treat the signs, not the unknown cause.
Exactly. Supportive care is the absolute cornerstone.
So that means things like IV fluids if they're dehydrated.
Definitely. Fluids are crucial. And nutrition, high-calorie food may be a feeding tube if they have Megaesophagus and can't swallow properly.
A feeding tube might be necessary.
Quite often, yes, to get calories in and reduce aspiration risk. In really severe cases, if the gut isn't moving at all, they might even need parenteral nutrition feeding directly into the bloodstream.
Okay. What about the other issues? The dry eyes.
Lubricating eye drops or ointments are essential if tear production is low. Keep the corneas healthy.
And the dry mouth or nose.
Humidification can help, keeping the environment moist.
And the bladder, if they can't pee.
Manual expression, gently squeezing the bladder several times a day to empty it, that's often necessary.
So a lot of hands-on nursing care.
A huge amount, yes.
Are there medications that can help?
Yes, medications target specific symptoms. Antibiotics if there's a secondary infection, like that aspiration pneumonia.
Makes sense.
For the gut issues, maybe prokinetic drugs like metoclopramide to try and stimulate movement.
Try to get things moving again.
Right. For urination and maybe tear production, a drug called bethanechol might be tried. It stimulates those functions, but the source adds a caution. It notes that manual bladder expression is often more reliable than relying on the drug. The response can be unpredictable.
Okay. So meds might help, but manual care is key for the bladder.
Often, yes. For the light sensitivity, ocular pilocarpine drops can constrict the tupil and make them more comfortable.
Like the diagnostic test, but used for comfort.
Exactly. And if that echo showed poor heart contractility, a drug called pimobendin might be used to help the heart muscles squeeze better.
Okay, so targeted meds for specific issues. But then there's this really big warning.
Ah, yes. This is critical. Denervation supersensitivity.
Sounds serious. What does it mean?
It means because the normal nerve supply is damaged or gone, the target organs, the muscles, the glands, become extra sensitive to certain drugs. Specifically, direct-acting cholinergic or adrenergic drugs.
So they overreact.
Massively. The receptors on the cells essentially get upregulated. They become hyperresponsive. So even a tiny dose of one of these drugs can cause a huge, potentially dangerous effect. Well, the warning is stark, especially for adrenergic drugs, those that mimic the sympathetic system. They could potentially cause fatal tachyarrhythmias, really fast, deadly heart rhythms.
Whoa. So you have to be incredibly careful with dosing.
Extremely careful. The advice is to start at less than 10% of the low end of the normal dose range, and then only increase at tiny amounts very slowly while monitoring like crazy. It's walking a tightrope.
That sounds incredibly challenging for vets to manage.
It absolutely is. The risk is very real.
Okay, so treatment is complex, supportive, and requires extreme caution with certain drugs. What about the long term, the prognosis?
Yeah, the source is blunt here. Prognosis is guarded.
Guarded. That doesn't sound good.
No. Sadly, many animals either die from complications like aspiration pneumonia or they're euthanized because their quality of life is just too poor due to the ongoing issues.
That's tough. Do any survive?
Some do survive, yes. But often, even the survivors have some degree of permanent autonomic dysfunction. They might need lifelong management, like continued bladder expression, special feeding, eye care.
So even survival often means ongoing intensive care.
Often, yes. It's a very difficult condition.
Okay, so let's try and summarize this deep dive. Dysautonomia, or Key-Gaskell Syndrome. It's this really complex failure of the body's automatic control system.
Right, the autonomic nervous system.
It affects multiple organs, mostly seen in younger rural dogs in certain areas, but the cause is still a mystery. The signs are incredibly varied: gut, bladder, eyes, heart, general well-being, reflecting that widespread system failure.
And diagnosis involves recognizing that pattern, ruling out other causes, and sometimes using specific tests like the pilocarpine or atropine response.
Treatment is all about support fluids, nutrition, managing specific symptoms like dry eyes or inability to urinate, and being super cautious with certain drugs due to that supersensitivity issue.
And unfortunately, the prognosis remains guarded, with many not surviving and survivors often needing lifelong care.
It really highlights how vital that silent automatic nervous system is, doesn't it?
It really does. And it underscores the challenges, when we face a condition where the cause is unknown and the effects are so widespread and variable, it's tough for everyone involved.
Definitely. So thinking about that unknown cause and the geographic clustering, here's something to chew on. What kind of research do you think holds the most promise? Is it digging deeper into environmental toxins in those specific areas? Could it be some obscure infectious agent we haven't found yet? Or maybe even a subtle genetic link that makes some dogs more susceptible to whatever the trigger is?
That's the million-dollar question, isn't it? Where do you focus the effort for the biggest breakthrough?
Lots to think about there.